As spring came, China had passed its peak of the novel coronavirus epidemic. Meanwhile, the outbreak was spreading rapidly across the globe. The World Health Organization called for countries to take urgent and aggressive actions.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
During a Politburo Standing Committee meeting on March 25th, President Xi said the country had a new challenge on its hands. March 13th was a milestone in China's prevention and control efforts. That was the first day the number of imported cases surpassed the number of new locally transmitted infections on the Chinese mainland. In response to the new dynamic, Chinese authorities strengthened prevention measures at the country's entry ports. Health control measures of China's major airports were upgraded to their highest levels.
It
takes about 10 minutes for each passenger to undergo an epidemiological investigation. We pay special attention to each passenger's physical and mental state to see whether they have made a truthful declaration.
But that was not enough. As the largest global aviation hub in China, the capital city Beijing was under immense pressure to curb its rapid rise in imported coronavirus cases.
Starting from March 23rd, all international flights bound for Beijing will be diverted to 12 neighboring cities.
In addition, passengers would undergo virus screening and a 14-day quarantine at designated places in the first landing city before entering the capital.
The staff were very warm and considerate. They checked my health condition every day. The daily necessities were replenished in time.
Despite the country's best efforts, a number of small clusters did emerge. In early April, parts of Suifenghe, a small Chinese city on the Russian border, were placed in lockdown over a sudden surge in cases. The border was closed to people, although not the flow of goods. Previous returnees had all been sent to quarantine, and a 600-bed isolation hospital was built in 3 days. Despite some international criticism of China shutting its borders to virtually all international travelers, the country's top respiratory expert said the government made the right decision.
It's necessary for that. So although it caused some inconvenience for the individual, for the whole country, it's good, it's correct. So that's why we are now quite stable, under control.
On April 8th, another milestone was hit. Wuhan, the city at the center of China's outbreak, finally emerged from its 76-day lockdown. On the same day, at a meeting of top leaders, President Xi asked the country to continue the fight against COVID-19. To get the economy back on track while ensuring against a COVID-19 resurgence, officials resolved to reopen the country slowly but surely.
Wuhan people like to have their breakfast outside. When breakfast comes this way, we feel at ease, and it adds more vitality to the city.
Around the country, restaurants started expanding their opening hours and increasing the limit on customer numbers. Schools across China gradually reopened, first for graduating students, then for younger students, and strict COVID-19 prevention measures are a must.
Students with fevers will be taken to the observation room, and if the temperature is still high after rechecking, our epidemic prevention staff will contact the community to send him to a hospital.
In Wuhan, like many other cities, people still need to be tested for the virus before they can resume their jobs or studies.
Since mid-March, the testing has been largely attributed to the resumption of businesses and schools. The coincidence rate of the testing kits is up to 97%.
On June 1st, Wuhan completed its citywide nucleic acid testing for nearly 10 million citizens and reported only 300 asymptomatic cases. The result proved the city was able to prevent any further spread of the coronavirus. However, after 56 days without any domestically transmitted cases in Beijing, the city reported a new case on June 11th. Over 200 new cases were then recorded in the following 9 days. The bulk of infections were traced back to a major wholesale produce market known as Xinfadi, located on the southwestern outskirts of the city. With the experience of Wuhan in mind, swift actions was taken in the nation's capital. The entire Xinfadi market was shut down within 48 hours. In less than a week, Beijing locked down dozens of residential areas and raised its virus emergency alert, while also closing schools and limiting travel. More than 2 million people were tested over a span of 10 days following the flare-up. Large-scale testing is still underway.
Beijing's recent coronavirus outbreak has been brought under control. The trend will persist for a period of time, but the number of cases will decrease.
As medical authorities caution residents to be on high alert, the presence of COVID-19 is still very much in the back of everyone's minds. Habits developed during the epidemic have become social norms. Face masks are ubiquitous. People keep their distance in public and at work, and millions continue to work from home. The overall strategy guarding against imported cases and a rebound in domestic cases looks set to remain unchanged in China for a long period of time.